So trauma is a word and an experience that has become so misunderstood in recent years. And so in this video, I'm going to outline 6 different misunderstandings and myths about trauma. Hey everybody, my name is Dr. Scott Giacomucci. I am a trauma therapist and trauma educator in Pennsylvania. And this video is going to cover 6 different misunderstandings and myths about trauma and experiencing trauma. So the first myth is that everything is trauma. Nowadays, it feels like the term trauma is being applied to almost everything. And this is far from the truth. Everything is not trauma. Trauma is defined specifically as an event that overwhelms our ability to cope and leaves us with a wound, an emotional wound, a psychological wound, sometimes a physical wound. But it's the negative impact from an overwhelming experience. So this makes it difficult to define trauma because it is by definition very subjective, that multiple people could experience the same thing, and some of those people would experience it as traumatic, and other people would not experience the same thing as traumatic. However, as the experience of trauma and treatment for it has become less and less stigmatized, it has led to increased awareness about trauma and PTSD, which is wonderful and great. But it also has led to an overuse of the term trauma, that every experience of adversity or loss or discomfort simply is not trauma. So it's important that we're using the term thoughtfully and precisely and specifically. And at the same time, we don't get to decide what is or what is not trauma for somebody else. We get to decide that for ourselves. Again, trauma is a subjective experience, but we don't get to decide that for everybody else. So the first myth is that everything is trauma. The second myth, the second misunderstanding that I want to highlight, and this really comes from kind of an old idea that only veterans experience trauma and PTSD. I hear this a lot, more so from the older generation of clients or therapists that I work with. And I think it comes from the history of the study of trauma and PTSD, that post-traumatic stress disorder was really developed as a diagnosis, specifically looking at the experience of veterans. So many people have come to believe or have come to become conditioned to believe that only war veterans experience trauma and PTSD, and that the adversity that other people experience can't be considered trauma or traumatic and doesn't lead to PTSD. And this is false. This is wrong. Of course, veterans do experience trauma and do develop post-traumatic stress disorder. And many other people also experience trauma and develop post-traumatic stress disorder. So trauma and PTSD are in many ways a universal, that they impact every community, every type of person, every profession, every age group, every culture, every gender. Everybody has the potential of experiencing trauma and developing PTSD. So while veterans certainly do experience trauma and PTSD, they're not the only group that experience trauma and PTSD. The third myth about trauma that I want to debunk is that trauma is only something you experience directly and firsthand. This is wrong. Trauma is often something that you might experience directly or firsthand, but oftentimes we experience overwhelming events secondhand, or we witness somebody who does directly experience something traumatic, something firsthand. And it can also be traumatic for us to witness that, or to learn about a loved one who experienced something life-threatening or sexual assault or something adverse. And there's an entire area or type of trauma called vicarious trauma or secondary trauma. This is when we're repeatedly exposed to disturbing details of other people's traumas, or we hear really disturbing details of somebody's trauma story, and we experience what we call vicarious trauma because of working with that person or being in relationship with that person or hearing or seeing the disturbing experience that they had. So trauma can certainly be something we experience secondhand. And the most recent update to the diagnosis of post-traumatic stress disorder in 2013 changed the criteria of the stressor that qualifies you for a potential PTSD diagnosis to now include vicarious trauma. So trauma can be something you experience directly, but trauma can also be used to describe something you did not experience directly. The fourth myth about trauma is this idea that trauma only has a negative impact on people who are weak. I think this is a really stigmatizing and frankly an ignorant judgment, an idea that many people have. And many people have that belief until they experience something traumatic and are really impacted by it. Trauma does not only impact people who are weak. Trauma can impact anyone and everyone. Many of the clients that I work with in trauma therapy are some of the strongest and most resilient and courageous people that I have ever met, and they were impacted by trauma. I've worked with folks from all different walks of life, some of the strongest and most resilient first responders, community activists, healthcare workers, educators, teachers, doctors, leaders who most people would look at them and say, that right there is a strong human being, a resilient person, and they experience trauma and are negatively impacted by it. So being impacted by trauma does not mean that you're weak or defective or something's wrong with you. I would argue that being impacted by trauma simply means that you're human and that anyone and anybody can be impacted by trauma. Now, there are certainly factors, what we would call preventative factors or resilience-related factors that can make it less likely that somebody's impacted by trauma. And some of these factors have to do with the individual, but many of them are more related to whether or not that individual has supportive relationships in their life and feels rooted and grounded within groups and communities and their family. So the idea that people who are impacted by trauma are weak is simply not true. The fifth myth about trauma that I want to debunk is this faulty idea that PTSD is a lifelong diagnosis and that trauma changes you and changes your brain forever. This, again, is simply not true. Of course, PTSD can be chronic and pervasive, and it can impact us throughout our life. And trauma, the experience of trauma does change our brain, and it can change who we are, but the impact of that does not have to last forever. And you can certainly heal and recover and bounce back from trauma and be no longer diagnosed with PTSD. And I see this all the time in my clinical practice. Actually, in one of my research studies about an inpatient addiction treatment center I work at, where I facilitate a trauma-focused psychodrama group, I find that about 80% of the clients who meet criteria for PTSD when they start my group and they come into inpatient treatment, 80% of them are no longer meeting criteria for PTSD diagnosis 2, 3, 4 weeks later when they discharge from inpatient treatment and they complete my inpatient trauma group. So PTSD is certainly something that you can recover from, and it is not something that has to impact you forever. The sixth myth and misunderstanding about trauma, and maybe perhaps this is the most important one, is this faulty idea that trauma only creates negative impacts and only causes PTSD. This is wrong. Of course, trauma can and often does lead to negative impacts for an individual and can lead to PTSD. However, the reality is that trauma also challenges us to grow. Trauma leads to positive changes within our self, within our personality, within our relationships, within our life. And there's an entire field of study dedicated to this now, dedicated to this phenomenon that is being called post-traumatic growth. This is the experience of growing because of adversity, because of trauma, because of difficulty. And the research about this is pretty compelling, actually suggesting that post-traumatic growth is more likely after trauma than post-traumatic stress disorder. That in the research they find about 1 out of 4 adults that experiences trauma is going to go on to develop PTSD, whereas 2 out of 3 adults that experience trauma report some form of growth because of the trauma itself. So statistically, when you experience trauma, you're actually more likely to experience growth afterwards than you are to develop PTSD. Now, in reality, when we experience trauma, it's also quite common for us to experience both some aspects of post-traumatic stress and some aspects of post-traumatic growth. So we might be tempted to think of these as complete opposites, because in many ways they are opposite. However, the paradox is that they often coexist at the same time. So the idea that trauma only causes negative impacts is simply wrong. And you can find examples of positive impacts from trauma and post-traumatic growth in every story, every myth, every metaphor, every person who's in recovery. The kind of hero's journey, the typical storyline and arc that almost every movie and story and myth and legend follows is a story of post-traumatic growth, of an individual experiencing difficulty and harm and adversity, and as a result of it, growing. If you wanted to learn more about post-traumatic growth, I'd encourage you to check out some of the other videos on this channel that are devoted entirely to this concept of post-traumatic growth and the concept of vicarious post-traumatic growth, which is the opposite of vicarious trauma. The phenomenon of professionals who work with trauma survivors growing as a result of their work. So these are 6 different myths or misunderstandings about trauma. I hope this video helps you better understand what is really true and real and valid about trauma. And I hope it helps put to rest some misunderstandings about how we're talking about trauma and how we're thinking about trauma. So if you found this video useful, I encourage you to subscribe to our channel so you'll get notified about future videos related to trauma, trauma therapy, trauma recovery, trauma-informed care on this channel. And I truly hope that you find this video helpful in your journey of healing from trauma or helping other people heal from trauma.